most common thing that people call Vet1 is for, I need to know SPO2 probe. So it is really common. They are probably the most highly used piece of monitoring that you will use in clinic for your patients, monitoring anesthetics or if they've come in critical condition. But with that is that they do get damaged quite easily. Get, blood on them, water on them, anything you can think of, especially with where we put them on the patients. They do get worn and they do often need to get replaced. So at Vet1, we decided to create kind of like a generic probe that's about a quarter of the price of other leading kind of SPO2 probes. This does come with, sometimes you've got to buy 2 adapters as well that hooks up to your monitoring, your handheld monitoring equipment. This is an all-in-one lead. It's got the same adapter so you can attach it into all of your monitors that you've got in the equipment, just like the others. And we went through a bunch of probes and we trialed them in clinic and said, hey, this one's not great, this one's not, clamping, and we developed the best probe. It has got this nice kind of memory foam in it as well, so it kind of molds to the patient where you've got them. It's not just kind of like a plastic probe clamping onto a patient, slips off when it's wet, it kind of molds around. This has got a nice kind of grip in it, so wherever you put it onto the patient, it holds, and it gives you a really good reading and a fast reading as well, which I think is really important. And if you are going through these quite commonly, you don't want to be spending a huge amount on something that you kind of go through every couple of months or so. So it's definitely an option if your clinic does kind of run through them a lot quicker than others. So that's definitely an option if this does affect you guys in your clinic.